Research and an associate editor at the Journal of Population Economics. She's a labor economist with interests in health policy and economic demography, and is published in some of the leading journals in the field, including the Journal of Public Economics, the Journal of Human Resources, Journal of Economic Perspectives, the American Economic Review, Economics of Education Review, and the Journal of Health Economics. Welcome.
Thank you. Hello. It's very good to be here. As I mentioned to some of you, this is my first in-person seminar in a long time, since maybe the last time I was looking for jobs. So forgive me, I may be getting back into the swing of it a little bit. I've also had a very packed schedule today, so I might lose my voice a little. But I'm really, really excited to be here. It's just been a great day. I've gotten to talk to so many great people. Today I'm going to talk about health insurance coverage after job loss. Job loss is something I've been studying since my second year of grad. About her work on job loss, which she'd been doing for a long time. She was like, yeah, it kind of fell out of fashion for a while, and then the recession hits, and all of a sudden everybody wants to talk to you, and all of a sudden your research is trendy again. I've found that if you kind of stick with it long enough, job loss comes back in trend fairly often. And so COVID has brought us back again to this period where job loss is really relevant for the current events. So I should mention quickly my co-authors are Chloe East, who's at UC Denver, Alira Kuka, who's at George Washington University, and Mariana Zerpa, who is at KU Leuven in Belgium. Okay, so the motivation for this paper is, as I mentioned, I've had a lot of work on job loss, and a couple of papers. I'll show you some results from my previous papers about job loss and health for adults and for children. Job loss is particularly relevant for health because it's both a negative income shock, right, and also a stressful event, but it also directly results in a loss of health insurance or for a change in the source of health insurance. And this is true for workers themselves, but also for their dependents who might rely on them for health insurance, through their employer. So in the short term, after job loss, families are potentially exposed to gaps in insurance coverage. And our paper right now is about the pre-ACA era. And so this was even more true, particularly for adults. This risk of having a gap in insurance coverage was even sort of more serious in the pre-ACA era. There's potentially a high cost of maintaining private coverage. I know COBRA. There's a switching cost. If you want to switch to public coverage, for example, there's kind of a fixed cost to applying and learning and having a new network and things like that. You may end up with diminished access to health care in the meantime, right? Even if you stay with insurance, but you switch to a different provider insurance network, it may be that people sort of diminish their use of health care during a period after job loss. And there's a potential risk if you're uninsured of high out-of-pocket costs. So I know when I left one job to go to graduate school, had like a couple-month window where I didn't have health insurance in between, and it was like probably going to be fine, but I was really afraid that I was going to get in a car accident or something like that. And so there's a risk, right, when you have these uninsured spells, where even if you're a healthy person, there's a risk of a really high out-of-pocket healthcare cost. And then, as I mentioned, this topic comes back, with COVID. We had sort of this correlated aggregate employment and health shock that was happening at the same time, right? There was a global pandemic, and also a lot of people are losing their jobs. And so this question is sort of relevant. So our research question is really simple, and part of this paper is just in being really clear and descriptive about changes in family health insurance coverage with job loss. And we're particularly interested in this family aspect of it, so not just like how do workers, how does their health insurance change after they lose their job, but what happens to their kids, right? What happens to their, adults in the family, like spouses and things like that. It's going to turn out to be really important to differentiate by income level because as you saw maybe by the title, eventually we're going to be looking at safety net programs. And so the likelihood that you take up public insurance after job loss, or that you had public insurance, or that kids had public insurance to begin with before job loss, depends really strongly on what their income level is. And so we kind of did these income cutoffs based on the idea of sort of always eligible families for Medicaid versus, you know, at the margin. And this 125 to 400% is the group that's sort of eligible in some states and not in other states. And then this sort of, you know, at this income level, never eligible for Medicaid income group. And we're going to show that this split is really important for understanding the landscape of loss. Yeah?
Just a small definition sort of on how are we sort of thinking about job loss for how long, it ever happening, how long you're unemployed?
Yeah, so the job losses we're going to look at are going to be involuntary job losses. So we're going to try to look at, you know, layoffs and plant closures and things like that. The duration, we don't ever condition on duration because it's endogenous, and that's one of the challenges of looking at job loss. Is you'd really like to be like, let's compare people who are unemployed for a really long time and people who get jobs really quickly, but it turns out that, like, say what happens to your health while you're unemployed really determines how quickly you get reemployed. So all I will do really is show you event study pictures that show here's employment, you know, relative to the time of job loss, here's earnings, so you can kind of see on average sort of how long these shocks are affecting employment and things like that. But we're not going to really stratify on that. But also, you know, we'll be looking at sort of take up of private insurance as an outcome, and you can sort of assume like people can take insurance through spouses, but also a lot of their like retake up of private might be through reemployment and things like that. Yeah. Oh, hi.
Hi, my friend. I need to see you soon on campus. When you say below 125% of the federal poverty level, 125 to 400, above 400, are you not going to distinguish between the experience in states that expanded Medicaid versus ones that didn't? Because then the numbers would be different. The categories would be different.
Yes, so that's a great question. So two parts of the answer. So one is the main focus of this paper is on kids. And so for kids, there was SCHIP and, you know, Children's Health Insurance Program expansions in the 90s, and it's actually the state variation in the thresholds and sort of eligibility over that period that we're exploiting to interact with job loss. We end in 2013, and we're not going forward into the ACA era, sort of intentionally because there was expansions. And actually in ACA, I'll show a bit at the end of our sort of future work looking at Medicaid expansions in the ACA, but that was much more relevant for adult access to Medicaid. And so that may have spillover effects on whether children take up, but children's own access to Medicaid did not change very much during ACA implementation. But yeah, but these cutoffs are sort of arbitrary, and I actually think, so one of our data sets that we're going to use, we have to go to the data center to do any of our work. And so there's actually this sort of lag between like finding our preferred specification in the one data set and then implementing it in the restricted data. And I think for some specifications, we actually use 140 as the cutoff instead of 125. So it's kind of, these are kind of arbitrary groupings. Yeah, but that's a good question. And so then what we want to do once we establish these sort of pictures of what happens to insurance coverage after job loss is to ask like how policy mitigates these effects. And in particular, we're interested in the mitigating effects of Medicaid or SCHIP, generosity, and unemployment insurance. So those are the two programs we're going to focus on here. At the end, I'll talk a little bit about our work that we want to do with the ACA. But if anybody's worked with the SIP, they completely reformulated the SIP between the 2008 panel, which goes through 2013, and the 2014 panel, which covers the post-ACA era. And so we're just dealing right now with trying to make a really consistent pre-post-ACA. Okay, so just to give a little bit of motivation, looking at insurance coverage for unemployed workers. So if we look at children with married parents in 2008, this is from the ACS, and this is just in a period where there was a lot of unemployment. That's why I picked 2008. If you look at insurance coverage for children, which is the darker bars, and for fathers, which is the lighter bars, they're fairly similar. Kids have higher rates of insurance. This is a 0.93. So 93% of kids have insurance coverage. 89% of dads have insurance coverage when the dad is employed. This is just a cross-sectional comparison, but when the dad is unemployed, 86% of kids have insurance, so still a large share, and this speaks to the sort of generosity of children's health insurance plans. 67% of dads. So you see a big drop-off in parental insurance coverage. If I look at single mom families, again, kids are at 92, 93%. Moms, 84% insurance coverage when mom is employed. When mom is unemployed, kids are at 89, and moms drop down to 75%. So the takeaway are much more likely to be uninsured.
These individuals are unemployed for the moms and dads themselves.
Yeah.
What is their typical source of insurance? Is it through some kind of public thing? Is it the
Here, I think this picture is going to show you. So here we go. So this is looking at employer-sponsored health insurance coverage, and I think this includes COBRA, but maybe also employer-sponsored coverage through a partner, because this is still the married parents. The colors are not consistent with the previous slide here. I'm not sure why. But if you look at employer-sponsored health insurance coverage, you can see that more kids or fewer kids are on that because more of them are on Medicaid, even when the parents are employed. Right, but 77% of fathers who are employed have employer-sponsored health insurance. When you go to unemployed, still these similar rates of kids and parents that have employer-sponsored insurance, but you can see this huge. And so the idea is to show here, you know, kids are more likely to be on Medicaid even when their parents are employed, again, because Medicaid is more generous for children than for adults. But then when fathers become unemployed, this gap grows. Okay, so you know, and you see this big increase in take-up. So kids are taking up Medicaid when their parents are unemployed. But this is just cross-sectional. It's, you know, it's just unemployment. It doesn't deal with the exogeneity of that or anything. Okay, so sorry for these being tiny. So this is from my study from 2015 looking at job loss, involuntary job loss, on health insurance status and healthcare utilization of adults. Motivating information based on previous work that I've done. And what we're showing is that, you know, in the round before displacement, there's a little bit of a drop. This is a 2 percentage point drop in health insurance coverage. In the current round, there's a 13 percentage point drop in any health insurance coverage, and that lasts about 9 percentage points of that lasts to the next round. And what we show is...
What do you mean by round?
Sorry, this is in the... that's a good question. This is in the SIP data. And so it's waves of the survey, basically. So we divided it by waves of the survey. And so then this is the medical expenditure panel survey. So this is rounds that are percentage point drop in private insurance coverage after job loss relative to 2 periods before job loss. And you see a very small offsetting effect of public insurance, about a 1.3 percentage point increase in public insurance, so that you see a really large increase in, well, a decrease in having any insurance coverage, and an even bigger increase in at least having a gap. Okay? We didn't find a lot, and this isn't really relevant for today's talk, but we didn't find a lot in the way of healthcare utilization effects. When we looked at children, so this is a different paper with my co-author Mariana Zerpa from the paper I'm talking about today, where we looked just at kids and we said when parents lose their jobs, what happens to kids' health insurance coverage? Well, what we saw here was a much bigger offsetting effect, right? So kids, about 13 percentage point drop in private coverage, but a full 6.5 percentage point increase in public coverage, so that their loss of insurance was much smaller. And so this, sort of again bringing back this idea of like kids are more protected. And the question is sort of what role does Medicaid and sort of Medicaid program generosity play in this, and sort of what are the determining factors in which kids and who takes up Medicaid after job loss. Okay. So in this paper, what we're going to do is we're going to use shocks to employment status within families, and it's going to be primary parent job loss. So that's father and two-earner households and mother and single-parent households. So these changes in employment status within families to look at the association between parental employment status and insurance coverage for parents and children. As I mentioned, part of this study is just cleanly identifying these effects and describing them. So we're going to use graphical event study methods to sort of clearly delineate the dynamics of what's happening to insurance coverage after job loss, as well as other outcomes surrounding this sudden loss. So the idea is that yes, with job loss, there may be factors that lead up to, a layoff or things like that. Even involuntary job losses are not completely exogenous. But to the extent that we see really discrete changes in insurance status, we can sort of attribute those to the discrete change in employment status that happens. And so then our question is sort of how long do those effects last? What are the dynamics of insurance coverage of different types and things like that. As I mentioned, right, this middle income group at the 125 to 400% of the poverty line is going to be a group that's really at the margin of public insurance take-up. And then we're going to examine interactions between job loss and the state generosity of important social safety net programs with our focus on Medicaid and unemployment insurance. Yeah?
Quick question. So why was father chosen for being the primary parent and dual parent and mother chosen for single parent?
So we could do primary earner. It turns out to really not matter that much because fathers are just usually the primary earners. And I'm sympathetic to that argument because not in my house, but, but it just turns out, and part of it's for comparison, with other job loss studies, almost all of them use exclusively men, but we're interested, like for children's health insurance coverage, single mother families turn out to be very important. It's not important, we've tried it both ways. So we've done primary earner in two-parent households, meaning whoever earns more. It literally does not change the results at all. So maybe we should do that just because it actually is better to do it that way. So that's a good point.
And what is SCHIP?
SCHIP is the state children's health insurance programs. So mentions that states made to Medicaid access for children, and so federal sort of money that states implemented. And so states have, as you'll see, one of the things we're going to use state variation in eligibility cutoffs for SCHIP. Thank you.
Is there, sorry,
Yeah.
having that, Randy probably know better, certainly know better than I do. Is there much evidence of crowd out at all?
There is,
private insurance associated
yes,
with SCHIP?
there is some, and I'll talk about that a little bit. We do a little bit of heterogeneity. Yeah, there is some. And then we're going to use the medical expenditure panel survey, which some of you are probably familiar with, to look at the downstream effects on healthcare utilization and out-of-pocket expenditures to see whether, whether we can see changes in these outcomes after job loss and whether they sort of differentially change based on the policy environment. Okay, so our two programs are Medicaid and unemployment insurance. So here's my actual definition here. Medicaid CHIP is a safety net program aimed at low-income families. the mechanisms that we're thinking here are twofold. There's one mechanism that's just if CHIP is more generous, or if Medicaid eligibility rules are more generous, more people will be on it to begin with. And so they'll be less likely to lose their insurance when their parents' employment status changes. Right? The other is if the eligibility cutoffs are higher or the program. So that's this sort of safety net program piece of it. Unemployment insurance is triggered automatically with job loss. I mean, it's not triggered, you have to apply for it and get it, but just meaning like it is sort of, you're not on UI until you lose your job, and then you have to apply for it. It's become very, very prominent in the recent couple of years. And we know it's a very large social insurance program intended to smooth consumption during economic downturns. What's interesting about UI here, and what I think is one of our really interesting findings, is that UI income can sort of crowd out Medicaid take-up, because your UI income is actually counted in the Medicaid eligibility formula. And so on the one hand, we have this possible mechanism of having more income might allow you to buy health insurance, right? But on the other hand, we have that having more income might actually push you out of eligibility. Something that we sort of think not enough focus has been paid to these interactions between safety net programs, and I think there's a lot of potential, like across safety net programs, to look for these kinds of interactions. But the one we're going to focus on is this trade-off between, you know, taking UI income and becoming ineligible for Medicaid. Yeah.
Quick question: if the dad lost a job and the mom hasn't, can the mom add the whole family to her insurance?
Yes, usually you can substitute towards spousal insurance. So I mean, yes, they would have to have a job that offers employer-sponsored insurance and, you know, be sort of affordable to add the family. But yes, you absolutely can do that. And I think that's why we saw those rates of employer-sponsored insurance be so high among the dads and kids, even while the dad was unemployed. Some of that is COBRA, but COBRA take-up is not 40%, so a lot of that could be spousal coverage. Yeah.
I don't think that UI would crowd you out of the exchange, though.
No.
You look at different places where
we can. Yeah, we will. That's in the next project.
We'll talk about that when you get back to camp.
Yeah, that's in the next project. Okay, so Medicaid is the largest means-tested transfer program in the U.S. with total spending of $545 billion in 2015. It's public health insurance for low-income families. I probably don't need to explain this to this audience. It is targeted towards low-income children and their parents. It's a big program, right? 46 million kids are enrolled in Medicaid across the country. Eligibility is determined by family income, including earnings, unemployment insurance, SSI, welfare, child support, etc. This is all sort of pre-ACA. About 64% of children of job losers are eligible for Medicaid if we ignore UI. Just to give you an idea of how big this potential crowd out is, about 9 percentage points of those become ineligible if we consider their UI income. So this is our own calculation with the survey of income and program participation. We can kind of get a rough idea of, yes, there are actually families at that margin, right, who will get sort of pushed out of eligibility because of their UI income. And importantly for us, the income eligibility thresholds for Medicaid vary across states, by age of child, and they change over time. And so that's the variation that we're going to exploit when we do our comparisons later. These are super tiny. What I'm showing you here is basically how different the adult and child eligibility thresholds for Medicaid are. And I think this is actually even post-ACA. So you can see for parents, in a family of 3, the Medicaid eligibility thresholds range from 17% in Texas, which clearly did not expand Medicaid, to 138% in the states that did expand Medicaid. So that's the adult eligibility, whereas for children, in this same set of states, You can see South Carolina, for example, coverage eligibility for children ranges from 133% for kids aged 6 to 18 to 194% for infants, right? But that same state, the adult eligibility threshold is 67% for parents and 0% for other adults. Okay, so there can be states where there's really different eligibility thresholds for adults and for children. So the existing literature on Medicaid expansions has found increased application of the Medicaid generosity to what we're going to use in this paper. That people who have Medicaid access have used healthcare more. Medicaid coverage leads to lower likelihood of bankruptcy, lower medical debt in low-income households. In our own work, we find increases in Medicaid coverage, large increases in Medicaid coverage for kids after parental job loss, much smaller increases for adults. So the mechanisms that we're thinking here for the interaction with Medicaid generosity is that, you know, in some cases, job loss may cause parents and children to become newly eligible for public insurance. And so there also may be increases in program take-up for already eligible children, maybe because of increase in parent eligibility, right? So after a parent loses their job, it may be that Medicaid take-up in the family increases, like I said, because of new eligibility or just because take-up increases. Anti-crowd-out measures might matter here, such as asset tests. So one of the things I'm going to show you is that high-income families become eligible from an income standpoint, but don't take up Medicaid. And one of the reasons there might have to do with things like waiting periods and asset tests. So that could sort of limit the capacity for Medicaid to serve as a temporary source of insurance with job loss. Especially if there's a waiting period, you lose your job, you don't expect to be out of work for a long time. If there's a 6-month waiting period to apply for Medicaid, then you might just not use it as a safety net. This other piece, which is going to turn out to be really important for us, is that a lot of kids are going to be in that always eligible group, right? And in more generous states with higher cutoffs, there's more kids in that always eligible group, right? And so Medicaid acts as a steady source of insurance across periods of employment instability for those kids when there's more kids who are just on it continually. Switching to UI. UI is obviously cash benefits for people who have lost their job through no fault of their own. This is the most cyclically responsive safety net program to labor market shocks. In 2010, in the peak of the Great Recession unemployment, UI benefits paid out more than $144 billion. I don't even know what they paid out in COVID, but it had to be a very large amount. UI eligibility and benefit amounts are determined at the state level again, so there's state variation, by past earnings and work history. The eligibility criteria and the benefit generosity formulas vary across states. Benefit generosity. So in the UI literature, previous work has shown that UI benefits mitigate the fall in consumption. So Gruber's work, for example, looks at the discrete changes in consumption that occur with job loss and job finding, finds that UI smooths consumption. East and Kuka have a paper about this. It decreases precautionary savings, increases spousal labor supply, and improves consumer credit markets. Our paper is closest to Alira's paper, and she's one of our co-authors here. She studies whether more generous UI programs mitigate the negative health effects of job loss on displaced workers, so on the adults, and finds that higher UI generosity increases health insurance coverage for adults. This is going to be different than what we find. And the healthcare utilization of people who lost their jobs, and also improves self-reported health, though she finds no strong effects on reported health conditions. Compares health insurance coverage of unemployed workers relative to employed workers in places with generous UI versus not generous UI, and finds that UI generosity increases health insurance coverage. So that whole crowd out thing that I talked about does not seem to be happening with the broader adult job loser population. Okay, so that's our background and our motivating facts. The data we're going to use for this study are from two sources. We're going to use the Survey of Income and Program Participation, and we're going to use the Medical Expenditure Panel Survey. The SIP has its relative advantage in having monthly health insurance coverage information by source of coverage, not quite as detailed as the Meps, but still you can get public coverage, private coverage, various sources of coverage. Monthly, it's a longer panel, so we can observe people over a longer period of time. And it's just bigger than the Meps. On exact source of coverage. Is this your spouse's employer-sponsored insurance, or is this your employer-sponsored insurance? Is this, you can get COBRA, you can get lots of detailed information, and it also has a lot of healthcare utilization information. You can see, doctor visits and how much they cost and what procedures were done and what date they were, and all kinds of information. And so we can sort of look to see how job loss affects your sort of primary care utilization versus acute care versus emergency care, and differentiate that by program generosity and things like that. So the Meps is the one. The SIP is publicly available with state, which is what we need to identify program generosity. We need your geographic state location. The SIP is nice because it has detailed income information, including unemployment insurance. We're going to look at families with kids between the ages of 1 standard in the job loss literature to have some tenure requirement at the start to identify a job loss that is actually a shock to your employment. And this is actually a pretty tame one. Some people, in Jacobson, Lalonde, and Sullivan, it was like you had to have 3 years of straight employment experience. But this is a pretty small one, so we're actually including fairly mild, potentially fairly mild job losses. The Meps is the one that's restricted use to get state identifiers, and so some of the reason I didn't give you guys a draft today is that we've updated our methodology extensively using the SIP and gotten all these really cool new results, but we haven't yet rerun everything at the Meps. And so you're going to see old results from the Meps and new results from the SIP, and then we're going to meet them hopefully within the next month or two. So in the Meps, like I said, we have health insurance coverage by type. It's a sample of kids, same ages. We have 1 or more years of job tenure, and this is one of those inconsistencies that we're just going to fix. It was arbitrary. Similarly, primary earners job loss, and we have, let's see, about 1,800 job losses in the Meps. Yeah.
This thing about primary job earner, is that clear? I mean, it could vary over time. Who's the primary earner?
Well, so it's actually, this question got asked earlier, and I didn't even really give the full answer, which is that in my previous work, so it's actually primary earner, meaning fathers in 2-parent households and mothers in single-parent households. And the reason for this is that in my previous work looking at parental job loss, we find big adverse effects of father's job losses and much smaller and less adverse effects of mother's job losses. And part of that has to do with different, mothers not being primary earners, so they're not losing as much income, or they're not the primary source of health insurance coverage. Part of it has to do, we've talked a little bit about home production, and moms actually help kids when they're home, and dads don't as often, dive into home production when they're unemployed. And so there's these really big gender differences in what happens. There's also actually in sociology, there's research showing the psychological impacts of men's primary breadwinner status loss, and women just don't have that even when they are primary breadwinners. Apparently nobody gets quite as stressed out when they lose that status. So we just kind of followed that precedent and focused on fathers, but I am really interested in single mother families because those are a lot of Medicaid families are single mother families, and they're clearly primary earners in their households. Okay, so I'm going to start by telling you a bit and showing you, don't worry, I'm getting soon to pictures. The categories are layoff, employer bankrupt, employer sold business, slack work, or slack business conditions. So these are the groups that we're doing. We can restrict it to sort of more restrictive definitions of only employer sold or closed, but unfortunately with this kind of survey data you get to pretty small samples at that point. We've talked about this, primary earners, and we have this job tenure requirement. So what we're going to do for our event study, we're going to look at the period from 1 year before to 2 years after job loss. We can do monthly, but it's a little less noisy if we pool 2-month periods. We restrict our sample only to households with kids 1 to 17 when they're first observed, and only parents. When I'm going to show you adult results, it's only parents. We are estimating without a control group. I've been really deep in the woods in the econometrics of event studies. And again, this is something we've done it both ways. It really doesn't matter whether we include a control group or not. My current belief of best practice is that actually maybe we'll include a control group that are propensity score matched to the job losers. But we've sort of done that roughly, and it doesn't seem to change things. So for now, what we have is a timing-based identification strategy. So we're comparing people who lose their jobs to people who have not yet lost their jobs. We have individual observations in our regressions, and we're going to cluster our standard errors at the family level. We're going to estimate a model. It's a standard event study model, so we have outcome variable for child I at time t. We have individual fixed effects. Also doesn't really matter whether we have fixed effects or not. We have 2-month pairs relative to job. We're going to omit S equals 6, and for identification we need another restriction, and I think we also omit, I want to say it's minus 13 or something like that. That's something I'd be happy to talk to you about afterwards, but that's part of the diving into the weeds on event studies. That omission is not necessary. The extra parameter restriction is not necessary if you have a control group. So then we have time varying a bunch of controls. So we have individual controls like age and parents' marital status, month, so the time, number of kids in your family, and the reference month. So an indicator for reference month, because at the SIP there's like a seam bias where if you're in the month that they're asking you about, your responses are more accurate or different. So we have indicators for that. At the state level, we have state welfare spending, food stamp spending, earned income tax credit policy, and unemployment rate in our controls. Yeah?
So is this, not that I'm in any way the full-on sort of proponent of these new difference and difference models, but isn't this the scenario folks might be worried about most if there's sort of dynamics kind of in the treatment effect in terms of the comparison of I guess the later job losers and using the ones that earlier adopted and really not thinking about this the right one?
Our event studies just don't show, I mean, the effects are so large relative to the kinds of trends that we see that we're not super worried about that. So this, I mean, it is true that like, yes, I mean, we're interested in sort of dynamic treatment effects, and that's definitely when you're worried, like you can't separately identify pre-trends and dynamic treatment effects. But because our effects, like the job loss effects, like this is employment, right, in our event study, like the job loss effects are so large, and it's usually for this low income group that you see a lot of kind of trending leading up to job loss. If anything, that they're becoming employed before they lose their job. And so, I mean, we can think more about whether we can do some of the, you know, Borysac and Callaway, that kind of thing. It's interesting though, it's also like, it's not, the thought experiment here is not that we should see no pre-trends, right? Even though you go back, there's this canonical job loss study by Jacobson, Lalonde, and Sullivan that was in the AER in 1993, and like, this was really like the first major economics event study that was published. And they find wages are declining in these firms that are closing before they lose their jobs. It's not really surprising. It's dwarfed by the drop in earnings that happens at job loss. And so the implication is that, yes, there are some pre-trends and some slight sort of anticipation effects, but what we're really focused on is this sort of big change here. But I'm certainly familiar with that literature, and I think we can incorporate some of the new sort of methods. But it is, yeah.
Can you go back to the previous slide?
Yes. Yes, this one.
Yeah. The time varying and this individual and then state level control. Now, food stamp spending at the state level might be correlated to the likelihood that people take up the program for themselves.
Mm-hmm.
So,
you mean that whether they take up Medicaid?
well, the decision of the household.
Yes, that is true. And it's the same with welfare spending and things like that, right? But what we really want to sort of avoid, having happen is that our job loss is just proxying for, something like a really high local unemployment rate that's correlated with your health insurance take-up or things like that. And so it's sort of controlling for this kind of state like policy environment and unemployment is sort of being really cautious on that. But I agree that it comes at the expense that it's potentially also jointly sort of determined or endogenous. All of these things don't change, doesn't matter. We can leave it out, it doesn't change really anything. So, we sort of picked, because more often than not you see these controls are included and sort of requested, we put them in. But I agree that is correlated. What really becomes tricky is that then when we get to the interaction effects, we're trying to interact this job loss effect, and I'll show you these figures in a second, with the state program generosity. What we really need to be doing is also interacting with all of these other programs. They're correlated, but you don't want your state's Medicaid generosity to really be proxying for your state's welfare program generosity or something like that. But then it becomes really burdensome to have interactions with too many things. So that is the challenge with this paper. Okay, so I have explained our income groups sufficiently. So let me show you pictures, because this is the cool part. Okay, so this is just employment. Okay, so the line is the 2 months, before job loss. The 0 is the month that we observe that you have lost your job. So here is their large change in employment, and our omitted period is the 6 months before. And remember, there's this sort of requirement that you be employed for 6 months before you lose your job. So there's sort of a mechanical flatness here, but you don't see this huge change sort of before that even. And then the line here, the top line with the triangles, is the highest income. The purple line with the circles, squares, is the middle income, and the red line is the lowest income group. And so kind of remember those colors, because I'm going to show you pretty much every graph going forward is going to have that same set of colors. Yeah?
So if I'm reading this correctly, then 100% of the sample loses their job at time between -2 and 0, but then it looks like
you can be re-employed.
100% find a job within those 2 months, and so that's why that doesn't go.
Yeah.
It's not mechanically a -1.
Yes. So the question is, did you leave the job we last saw you with? And so you can say yes and be, for the reasons that I listed, right? Layoff and slack work and all of that stuff. And yes, but you can be re-employed clearly at a new job.
And do you guys see the industry in which the person was employed?
Mm-hmm. Yeah, in a SIP we can. We haven't done anything with it, but we can. Yeah.
The income categorizations are based off of, obviously, before the job loss, right?
That's an important question.
Yes.
About the industry.
Yes. Yes.
Do you have any information? Well, you would have this for Meps, but you're not using Meps for this part. I think. Do you have any information on race and ethnicity? Because if you could interact those, that might be very important.
Yes, we do. We have that information. We have not used it. We really are focusing right now on just these income cutoffs. sort of based on our inner interest in sort of Medicaid eligibility. But that is something we could do. We can identify both of those things. I mean, we can see industry and we can see race in both the data sets that we have.
But that might impact the job loss, the extent of the job loss, and what type of insurance you choose for a variety of reasons.
Oh yes, absolutely, I agree. Yeah.
That's why I asked.
Yeah. Yeah. Did you want to finish your? Okay. Okay, so over here we have earnings. This is a substantial earnings shock. And you can see that the earnings shock is, you know, you can see that job loss is a substantial and lasting earnings shock. And this is universal in the literature. You find that even though you see, you know, a good share is reemployed by 6 to 8 months after job loss, you see that, you know, for these two higher income groups, earnings do not rebound to where they were even after reemployment. So you see that job loss is a lasting earnings shock. And this is the parent sample. So this, to our knowledge, we haven't ever seen this for parents. We've seen it for men, basically. So here's the primary earners insurance coverage, which I'm going to let you compare to the children's insurance coverage, which I'll show you shortly. And here's where you can see that these income categorizations really do differentiate things. So the high and the low income groups, you know, bottom out around, you know, 12 to 18 percentage point decrease in private insurance coverage. So this 125 to 400% of the poverty line group is really vulnerable to losing their insurance after job loss. Public health insurance coverage, you can see that the lowest income group of adults is taking up private insurance after job loss, right? And you see this boost by maybe 2 months after job loss. You see this increase, and then it's fairly sustained over this long period of time. The middle income group takes up, this is about 5 percentage points of that 28 percentage points, right? So they take up a little bit. The high income group, there's actually statistically significant increases in public coverage, but they're in the range of like 2 to 3 percentage points. You know, all of these are fairly persistent, but what you see is this results in this really big variation over here in this graph of, do you have any insurance coverage, right? Where you have this middle income group is just, you know, has this much larger drop than either of the other two, and you don't see a huge drop for the lowest income group because they lose their private insurance, but they take up public insurance, okay? So that is the adults. Oh yeah, here's children's health insurance coverage. So what you see here is similar patterns here where kids of those middle income parents are the most likely to lose their private coverage. But look what's happening with Medicaid here. Right? Now remember, kids have access to a much more generous Medicaid eligibility framework than parents do. And so you still see like pretty similar patterns with loss of private health insurance coverage. They're smaller, so the middle income kids is about 20 percentage points drop in private coverage. But you see basically a 20 percentage point increase in public coverage, and it's this kind of gradual increase. So it's not like everybody just goes out and, you know, gets Medicaid right away, but there's this, you know, sort of steep increase up to 2 months, and then this kind of gradual increase even out to 22, 24 months after job loss. And you do not see kids of high income parents taking up Medicaid, and you don't see low income kids taking it up, and the reason for that is that they're all already on it. Okay, and so that intuition is something that's important to keep in mind, because sometimes we actually even see negative effects on Medicaid take up when Medicaid becomes more generous for that low income group, and it's because more of them are on it to begin with. So you don't see any effects, and so you end up with this actually really similar effects overall, right? Where for this middle income group of kids, Medicaid is really mitigating that loss of insurance coverage, and so they end up kind of all with a similar overall pattern. Yeah?
Are I know we talked earlier about maybe this kind of an information story and people are learning over time, but I'm just curious, do you think it could also be like income dropping over time for the middle income families?
Oh, yes. Well, it could be, I mean, if we go to the income picture, we don't see a sort of we do see it sort of sustained, and it could be maybe that people had expectations that they would become reemployed, and then when they don't, then they think, oh no, we better sign up for Medicaid. I think that's more likely, because you don't see that income sort of continually goes down. But what you do see is it's maybe more sustained than you thought, or maybe you become reemployed but you don't get health insurance like you thought or something. And so that could be part of it, that if people have initial anticipation of how quickly they'll find a job. So that's the children's health insurance coverage. Just to show you in the SIP, the cool thing about the SIP is we can actually look to see, like, does this mechanism make sense that we're thinking about with UI and Medicaid eligibility. So we can look at UI income by these income groups. This is as a percent of pre-job loss earnings. So this is like the UI replacement rate for these three groups. And you can see that the red group, the low income group, has similar replacement rates to the middle income group, because UI is pretty, well, it's progressive, and that the replacement rates are higher the lower income you are. The persistence of it is the highest for the low income group, and the lowest for the high income group. We also can put your predicted, like our estimate of whether you're eligible for Medicaid in the event study on the left-hand side, and basically look at changes over time and do we think you're eligible. And you can see this really striking thing, which is, like I said, no one's becoming eligible in the low group because they always were. This is kids eligibility. Really similar eligibility increases for high and middle from an income standpoint. But we don't account for asset tests or waiting periods or anything like that. So it could be that the high income group doesn't satisfy asset requirements, which are state specific. There's some. But also, you know, when you go back to this differential take-up here, there's a really striking difference here, and not nearly as striking a difference here. And, you know, asset tests aren't present everywhere, so it's not clear that that's all of it. It could be that there's stigma. It could be that there's lack of familiarity with, or, you know, with the Medicaid program, things like that for the high income families. Yeah?
Have you done that previous graph based on whether the state has an asset?
It does seem to be binding. Yes. It does seem to be binding. Okay, and then when we look at mediating effects, we're just going to do the same event study that we did before. When we do our regressions, we're sort of pooling periods. So we have like 0 to 6 months after job loss, 6 to 12, maybe 12 to 18. And then we're going to interact those pooled coefficients with these indicators of program generosity. So similarly, we have the same set of controls, and what we're interested in is there's this initial sort of set of treatment variables, the beta 1, and then there's this beta 3 that's going to be like the program generosity mediating effect that we'll look at. We've gone through a whole wide variety of Medicaid eligibility or different program variables. The way that this project came together is that Mariana and I had job loss and health insurance paper, and Chloe and Alira had these simulated eligibility measures that they were using for other research. Alira is like the UI specialist, and Chloe is in all this Medicaid research. And so it was this kind of like pooling of like, we'll bring our instruments, and you bring your job loss study, and we'll like interact and see what happens. It turned out to be kind of a mess. Like, it turns out that it's a lot to ask a really, clean, detailed event study and then start interacting your coefficients with, simulated instruments. So I'm going to be upfront about that. We're still trying to figure out, like, in my mind, once you start interacting, all of a sudden all of your controls are not meaningful in terms of those interaction effects unless you're also interacting them with your treatment effects. And so the variables that you're using could be proxying for a lot of things. So we'll sort of get to that. But what we're going to use is, I don't know if you're familiar with the sort of Curry and Gruber Saving Babies instrument, but this is a simulated eligibility instrument where we're going to take a fixed national sample of kids from families with unemployed parents. So like, what does this group of kids of unemployed parents look like in terms of their income and their demographics and things like that? Plug them through a Medicaid eligibility calculator for each state and year, so that we have a variable that is really just varying based on the program parameters, but not sort of endogenously changing based on who's in the unemployed pool. Okay, so we have this national sample of kids of unemployed workers, and we put them through this program calculator and figure out what fraction of these kids is eligible for Medicaid in each state year cell. Okay. And then we match that to the pre-job loss kids in our sample. So we assign you a how generous was Medicaid 6 months before your parent lost their job in your state. We also use the actual Medicaid threshold because some recent studies have just said, well, forget the simulated instruments. There's a lot of sort of, noise that comes from using those. Just use the actual eligibility threshold. Is it 140% of the poverty line? Is it 250% of the poverty line? So we've done that as well. Like, it's a little hard to reconcile the results between the two, but we get really similar stories. But when we do that, we standardize it between 0 and 1. Those two cutoffs. We have a variable that summarizes, do you have an asset test or not? So the 1 is state has an asset test, and 6 months before job loss. We also have a variable that says, does your state have a waiting period or not? And then we have Medicaid income eligibility. We could look at your actual predicted eligibility. That's what I showed you in that graph. Like, do we think you're eligible based on your data? And we put that on the left-hand side sometimes. UI generosity, we've settled on just not doing the simulated instrument because we have some concerns about the simulated instrument. So we're using this recent, I think this was an AER paper by Sue, Massa, and Meltzer, that just use max benefits, weekly benefits times number of weeks according to state, year, and number of kids in the family. What we would like to do is also include the simulated UI measure, but we're sort of fixing that right now. Okay, results. So this is looking at effects of job loss on just kids' health insurance coverage with our regression framework, so you can see that it matches our pictures that we showed you. Private health insurance drops between 16 and 17 percentage points. Public health insurance increases between 8 and 12.5 percentage points. So your loss of insurance is about 7.7% in the 0 to 5 months after job loss. Looking at the mediating effects, so this is our big interaction results in the SIP. The mediating effects of Medicaid and UI in those job loss effects. So here's our main effect in those regressions, and here's our simulated eligibility interactions, and here's our UI interactions. If you don't see a lot here, that's fine. We don't see a lot here. There's like some sort of suggestive evidence. You see like these positive coefficients, meaning that more generous Medicaid simulated eligibility is maybe associated with more take-up of public health insurance. We see negative coefficients here, but they're not at all precisely estimated, so we don't hang our hats on them. But there's some little like, okay, this is sort of consistent. This is not divided by income. Okay, so this is just the full sample. So there's like some evidence also of potential crowd out of private coverage here, but it's not precisely estimated. So our preferred specifications divide by income status. And so here we have our 3 groups, and these are just our interacted eligibility measures, and we show you pre-job loss and then 2 post-job loss periods. Effects. I'm not really sure whether that's spurious or not. But when you look at Medicaid coverage, what you see is that simulated eligibility in the periods after job loss decreases take-up for that low-income group, and that's that weird counterintuitive thing that more of them were on it to begin with, and so fewer of them could go on it after. So a lot of people see that and like, oh, doesn't that invalidate your findings? No, this is actually showing us that it's actually kind of a better safety net. They're less likely to take up after job loss because they were more likely to be on it to begin with. This group, the middle income group, you see these increases with higher simulated eligibility, meaning a larger fraction of that fixed national sample of children of unemployed workers become eligible or are eligible for Medicaid. You see that that's associated with these larger take-up of public insurance in our sample.
And you had kind of offsetting effects from the UI and for the simulated eligibility.
Yeah.
I'm curious, how highly correlated are is UI generosity with this?
We should have that picture, and I don't have it.
You might,
and they are correlated, right? Not surprisingly. States that are generous, yeah.
If they are correlated, you might be getting a mechanical relationship, particularly for the high income earners, in which it looks like they're trying to take.
Well, that could be because we separated here. That could be like this, for example. You're right that could be related to that or something. Well, so that's my main concern about this whole interacted thing in general is like, unless you're also interacting with state and year fixed effects and with other program generosity, you're right that interacted coefficient could be proxying for anything
you almost get like
that it's correlated with.
Fitting in some sense.
Yeah. Yeah, no, that's true. And these, I think, are separate, like treated separately. Yeah. No, I think you're right about that. That's definitely possible. Okay. I'm trying to remember where I am here. Okay, so, this is the asset test. There we go. Okay, so here's where I was. The asset test and waiting periods, here's this one little effect. I'm not, this is like high income people in the period right after job loss. There's this increase in staying on private insurance and decrease in take-up of public insurance that could relate to the asset test, but we don't find a lot here, and it doesn't seem to be significant for these lower groups. But these, yeah. Okay, and then let's see. Sorry, I'm not quite sure. Oh, sorry. I can't see the top line, and so I couldn't figure out. This is the actual Medicaid thresholds. This is what I told you. We have these two different measures of Medicaid eligibility, the simulated one and the actual one. When we use the actual Medicaid thresholds, the result doesn't hold quite as clearly, but the coefficients are, so here we have this negative effect here on take-up of Medicaid that again can be this like, that sort of effect of like more people are on Medicaid to begin with, and it could be that even in this regression, that's a little bit what's going on. Part of the problem is also these actual Medicaid reason for using the simulated is because we're worried about some endogeneity problems and things like that, but for transparency, since we're using actual UI benefits, I just show that. Okay, and then here's our eligibility regressions, and this is just to sort of confirm that thing that I was telling you that you also see when you look at your predicted eligibility for Medicaid, your increases in predicted eligibility, you find that those increases go down when there's more generous Medicaid, because in this group you're more likely to already have it, and that's actually true here as well, and this is when we are doing a different set of income cutoffs, which may sort of explain what's going on here with that sort of actual Medicaid threshold. And then here's the UI interactions when we just do sort of UI by itself and we do it separately by group. And you see an increase for this middle income group may be significant but marginal, and let me see if I can hurry up because I finished at 4:45. Okay. So what I want to show you is, here's the Meps results. What we find, this is our earlier model that we have not yet updated in the Meps, but we include both Here's our displacement coefficient. Our displacement interacted with simulated UI generosity, and our displacement interacted with simulated Medicaid generosity. And what we find in the main sample, we don't stratify by income, but we find really no effects of Medicaid generosity. These are the marginal effects. But here's that crowd out effect that comes with UI. So you see that UI decreases the likelihood of taking up Medicaid and of having any insurance in our Meps sample. When we stratify by whether you had employer-provided insurance before job loss, if we look at people who had employer-provided insurance before job loss, we don't really find these interacted effects very much, but we do find obviously big decreases in private insurance coverage. When we look at people who were uninsured before job loss, we do actually find this Medicaid generosity effect, where if you were uninsured, you're not only sort of more likely to take up Medicaid before job loss, but the more generous your state's Medicaid program is, the more likely you are to take it. I wasn't hoping we would find something, but I was really interested to see what would happen to healthcare utilization. I was really excited about how much I knew about the medical expenditure panel survey and how, all these great variables I could construct about, ambulant care sensitive conditions and acute versus chronic conditions and emergency visits versus routine visits. And I had all this stuff. You just don't really see, we didn't get into see changes in whether you had high out-of-pocket expenses. We didn't see changes in really much of anything here. And it could be that we don't have enough job losses, but I've certainly in other job loss studies, found like for adults you do see changes in utilization, but not for kids. Sorry, I don't know how to turn that off. So anyway, for I'm going to skip this actually because I want to get to the end. Did you have someone question? Okay. Okay. So here's us not finding effects on probability of going to the doctor, on number of doctor visits, on out-of-pocket expenditures, on high out-of-pocket expenditures. So our big question is, how does job loss affect family health insurance coverage? What I've sort of explained, it leads to large reductions in insurance coverage for adults, smaller reductions for children. The loss of private coverage is mitigated the group that really matters for this kind of margin of losing health insurance at job loss and for thinking of public insurance as a safety net, right? It's still a transfer program and it smooths consumption for that low income group because they're not losing their insurance because they're on it, but that sort of being at the margin of take-up is there for the middle income group. So that's something that we thought was really interesting about this study. This question of how the safety net mitigates it, as for some of the reasons that we've talked about, I'm not as confident about this sort of part of the paper. I think we find some suggestive evidence that Medicaid generosity does sort of increase take-up for that middle income group, and that there's some suggestive evidence that UI kind of crowds it out, but it's not super robust to a lot of things, and our estimates are kind of noisy, and there's some concerns about other things that it might be proxying for and things like that. So I see the pattern there, but I don't. Is that actual sort of periods of uninsurance for these families, or is Medicaid still a safety net in that if you go to the hospital you can sign up when you're there? And so maybe, it may be that there's sort of routine care that doesn't happen if you're not covered, but from a sense of like catastrophic expenses and high out-of-pocket costs, if you're eligible, the hospital will sign you up or the doctor's office can tell you you're eligible. And so in some sense, even if people don't know it, they're still somewhat covered. And so just from a policy takeaway standpoint, that's something we're wrestling with a little bit. Like, is it bad to be like, some kids have this big gap in insurance, but they're eligible for Medicaid? Is that an information thing that we need to sort of get the information out there to sign up sooner? Or, and if we found sort of decreases in routine care use, then we might be more concerned about it. But statistically, we don't see those, and so that's kind of an interesting thing to think about. I'm going to show you, I don't really have time to go into this, but I told you that we're going to do a little bit with pre-post ACA and job loss. The motivating picture here, well, there's some interesting pictures that are just insurance coverage of employed workers versus unemployed people, with the red line being the pre-2014 Medicaid expansion / marketplace opening cutoff. But you can see that there's some heterogeneity across groups in the degree to which these two lines came together after the red line, after the ACA was implemented. So you can see for certain groups, for example, males with less than a high school education, you can see that the ACA dramatically narrowed the gap between these two lines, less so, but even there for males with college education. You can look for high school dropouts. This is Medicaid coverage, so just to see to what extent is Medicaid coverage. Unemployed are the red, so they're higher now. High school dropouts, you can see actually males with a college education again are much more likely to take up or to go on. Unemployed males with a college education are more likely to be on Medicaid after the ACA. So I'm really interested in exploring more about this. My favorite picture is this one, which is my job loss event study. This is the post-ACA event study line, and this is the two pre-ACA lines, one that was pre-Great Recession and one that was the Great Recession. Both of those are really, really similar to each other, but you can see that post-ACA, that drop in insurance coverage with job loss is much smaller. Medicaid options. And to finish with this picture, this is kids of employed and unemployed workers pre and post ACA, and the landscape did not change a lot for kids. And so this is kind of an interesting opportunity to do kind of a contrasting study where suddenly parents and adults options really changed a lot. I will stop there. Thank you so much.
Thank you, Sarah. Any final question?
Real quick. Sorry. I mean, it's really compelling, that you're showing us, the importance of, Medicaid insurance coverage. But we don't really think of Medicaid and private insurance as perfect substitutes.
Absolutely, yeah.
So maybe an extension or something to think about. Do you have anything on health outcomes? Right?
We do.
This middle income group, right?
Yeah.
Children at least are keeping their coverage.
Yeah, so we do. And in my So yeah, in the original paper with Mariana, what we looked at was health insurance, healthcare utilization, and health outcomes after job loss, without the policy interactions, but just kids' outcomes after job loss. And we find negative mental health effects of parents' job loss, but really not much else. And similarly, we didn't find any changes in care utilization, but we find increases in mental health care utilization. And I think I mentioned this to some people today, but then after mothers' job losses, we found increases in infectious illness. It was mothers' job losses, we found reductions in infectious illness, like not going to daycare anymore, pretty much, I think, but not much else. And so, I agree with you. I think the health effects would be long run. There's this whole literature on ambulatory care sensitive conditions, and if you don't get care for this long period, then you would then be admitted to the ER for things that you could have treated. I don't think our windows are long enough to really observe. We've certainly identified those in our data, but we haven't seen effects. But I do think that's an important question.